So the first question is, why should I hire you? And I really feel as though I am the right person that has the skills and knowledge necessary to become a nurse, as well as the passion and the desire to promote patient safety at the bedside. Um, I'm very interested in bringing my own personal nursing philosophy into my practice, and in particular, going the extra mile for people. I have two experiences in particular that stick out to me as to why I want to be a nurse. One of which is seeing my grandmother in my later high school years with cancer at the bedside and visiting her nearly every week. I watched closely and observed the nurses, and I saw all the things they were doing to help my grandmother, and I really wanted to put myself in their shoes and be able to say one day, hey, I made it, and I can now help other people in the same way. Also, I was a patient myself earlier this summer, and I experienced the post-operative setting, up close and personally as a patient myself. And I really feel as though I can help return patients to their baselines and form close-knit relationships with the families, having been a patient myself, because I recognize the want to get better and what it's like to um, really have that urge. So, surely as a patient, I could be a nurse that knows how to make that happen. Question two is, why do you want to work for us? And from researching your company, I I realized that the mission is to provide a responsive healing environment for patients and their families, as well as to improve the quality of life for members of the community. And I like that the goal is to keep it community based in the grassroots tradition, um, as well as never losing sight of the women of the Village Improvement Association. Growing up in a small community like Penridge, I have become accustomed to the small community setting and what it's like to live and work with members of a small crowd. So I feel as though I could really blend in right away and help make my difference in the community and give back, having come from the same situation my whole life. So, and question, excuse me, question three are, what are three strengths and three weaknesses? And three weaknesses right off the bat. I know public speaking I would definitely consider to be a weakness at one point for sure. However, I did take a public speaking class to try and overcome that. So I feel a little bit better speaking with people of both the smaller and the larger crowds, because I learned how to communicate effectively and how to deal with my anxiety a little bit better. Since I know that I will be up close with patients every day, so it would be crucial for me to get over that. Second is that I'm sometimes too detail oriented. I feel as though I felt in the past that this was a problem because with waitressing, for example, um, especially when I first started out, I really chose the whole quality over quantity type of thing, type of worth ethic. And I know in that setting, for example, it is very important that the quantity of tables is just as important as how they are being treated, because it is a business, and I feel as though I could apply this to nursing and try and mix the two, the quality and the quantity, to care for as many patients as possible, as well as providing the best quality care um, at the same time. So I feel like waitressing has really helped out with that. And in addition, I often come off as too shy or maybe uninterested to some people, and I recognize this, but I do the best that I can as soon as people get to know me better, so I can show them that it's not a matter of being shy or being uninterested. It's just that my personality being more of an introvert, I like to say sit back and absorb new information and really take it in before I give my judgment about it, or before I speak out. And some strengths. I have include being very reliable. Um, I think I can count on one hand, maybe a total of 2 times in my 5 years of waitressing that I ever had to call out. Um, and very, very truthfully, it was because I was sick, and I always do the best that I can to make sure that I have a cover. My company that I work for now knows that I'm very reliable and they can count on me. If I cannot be there, they know that I will find a replacement to get the job done. I always work holidays, and I know that going into this profession as well, that people don't stop getting sick just because it's the holidays, and there's still people to care for, even though we wish we could be home with our families. And the last strength I believe is my best is being passionate. I really think the passion I have shows in the work I do, and I hope to bring that to nursing, and it has now become part of my own nursing philosophy, so I hope to bring that all together. Question 4 is, where do you hope to be in 10 years? And 10 years from now, I really hope to be in in a hospital as opposed to an outpatient center or, say, a hospice nurse. I'd like to be in the hospital setting as a clinical specialist in the PACU or possibly the intensive care unit, working 3 or 4 days optimally, 12-hour shifts, and really putting my own values and my nursing philosophy into practice. I hope to build upon my own nursing philosophy and better my mission of bringing both professionalism and passion into the same setting. Going the extra mile for patients has always been something that sticks out to me, and I want to make sure that I can be the nurse that people can rely on and patients can trust. If they have an issue and or they have a question about something that is dealt with in the operating setting, perioperative, postoperative, I want to be the person that they go to, that I have the knowledge and skills and the passion that I can bring to them. And I hope to also find a way to give back to the community in some other way, just besides giving medication. And question 5 is, what kind of people rub you the wrong way? So a certain type of people really rub me the wrong way, especially in the workforce. And these are the people that don't pull their own weight when working together to achieve a common goal or a project. I've experienced this from the time I was very young at 15 up until now, especially in waitressing. And like I mentioned in my strengths and weaknesses, is that I'm very detail oriented, so I like to see the task completed regardless of how it gets done. I remember a time in particular, it was Christmas morning of last year, and all the servers called out or simply just did not show up because it was a holiday, and I was not one of those people. So, leaving me with one server, we ran the entire restaurant, which left me with 16 or more tables at a time, and it left me alone with my regional manager, who I did not know very well. It was complete chaos, to say the least, and to this day, I look back on it as well as my other managers because they realized it was a job well done in a very tough situation. So I always like to use that experience as something to look back on when I'm doubting myself, and I know that I can complete a task or a shift no matter what challenges I face that day.